Hello, this is Dr. Thomas at Integrity Dental, and today we want to tackle another one of your frequently asked questions, and that would be the category of emergency dental care.
Dr. Thomas, what is considered a dental emergency?
All right, what is considered a dental emergency? That's a good question actually, because a lot of people are not sure when they need to be seen quickly and when they have a little bit of time. The simple answer would be that pain is often a very good indicator. All right, if you're not in a lot of pain, is probably not an emergency. Below, if we give you a pain scale of 1 to 10, below a 5 is probably okay to wait the weekend. Okay, as long as it doesn't get above that pain threshold. But there are different tolerances to pain, and everybody has a little different interpretation of what that 1 to 10 pain scale would be. But usually it's pain or lots of swelling. Okay, lots of swelling is another one that we would deal with, and sometimes swelling in certain areas, especially around the neck, where it could potentially cut off an airway. That's potentially a dental emergency as well.
When do I need to see an emergency dentist versus going to an emergency room versus scheduling a regular dental appointment?
When do I need to see an emergency dentist versus going to an emergency room versus scheduling an emergency appointment or a quick appointment with my dentist? When you need to see an emergency dentist is probably much more driven on how much pain you're in. If you're in so much pain you can't make it through the rest of the weekend, yeah, that's probably when you need to try to find some form of relief. If you are in any sort of danger to your health, like cutting off an airway or something like that, where it could endanger your life, that's a get to the emergency room sort of situation. If it is painful, but you can make it until your normal dental office operating hours, that's when you should wait. Always would be best to wait and see your own dentist, your own doctor, who's aware of your situation and knows your health history and all the other things in your history of treatment. Always will be better for you in the long run to stay with one person for your care as opposed to seeking care from an emergency dentist. However, there is a time and a place for that.
What are common types of dental emergencies and what can be done?
What are common types of dental emergencies? What can be done? The common types of dental emergencies are lots of pain and lots of swelling. And those can encompass a lot of different things. They can be from teeth, they can be from gums, they can be from bad implants and denture sores and things like that. So in the denture situation, a lot of times you can just leave dentures out, and those sores that are there will start to heal just because they're not being rubbed on. If they are teeth related, yeah, that becomes a much more important thing because you can't really take those out on your own. I've had patients try, but that usually leads to more complicated things like broken root tips that I got to go digging after and fishing out. And yeah, that's not real fun in that situation. An infected tooth, which sometimes you know about, sometimes you don't, but lots of swelling would be an indication there. That can be from an infected tooth or infected gums. That's a common dental emergency as well, and just lots of pain. If you can't go to sleep, that's usually in the dental emergency category. If you're in that much pain where you cannot sleep at night, yeah, that's pretty intense.
And what can be done about this list here of dental emergencies?
So what can be done about the list of dental emergencies, like, well, toothaches and abscesses and swelling and wisdom teeth, bleeding, inflamed gums, tooth sensitivity, broken and fractured teeth. And that's a good one I want to just speak to for a minute. Broken and fractured teeth is not necessarily a dental emergency. A lot of people assume that it is, that when you have broken or fractured a tooth, you need to be in and be seen right away, even if it's outside of normal business hours. But it's not. If you're not in pain, usually it's not going to make any difference to be seen on Monday versus Saturday if it's a broken tooth. But if you're swelling and got lots of pain because of that, broken fillings, broken dentures, losing a crown, things of that nature, unless you're in lots of pain and lots of swelling, Those are not really dental emergencies, and it will not do you any extra good to be seen a couple of days earlier versus coming in during normal business hours. But usually, when you have a lot of swelling and a lot of pain, that means that something is pretty seriously wrong. And usually that means either a very serious cleaning, a round of antibiotics, an extraction, meaning a removal, or a root canal, things of that nature to fix those issues. If it's a denture rubbing that's causing pain, you need a denture adjustment. But those are usually the treatment options for people that are in pain.
When do I need an emergency dental extraction?
When do you need an emergency dental extraction? Well, some of that's going to be dependent on you and what your goal is with your mouth and how much pain you're in and what you can afford to do. Unfortunately, it is usually a little less expensive to remove a tooth than it is to do a root canal and a crown to save a tooth, or a deep cleaning to save a tooth, or to put an implant in, or so on and so forth to save those areas. So sometimes in a patient's unique situation with their own personal finances, it may make a little bit more sense to just remove a tooth as opposed to trying to save it. However, for the patient's overall well-being, for the longevity, for overall health, for overall ability to chew and quality of life, it's always best to try to hold on to your teeth and save them if at all possible. But sometimes it's just not even possible. If you have a really bad break or really bad infection, sometimes there's a limit to what dentists can do even to save a tooth, and it may mean that you have to have the tooth removed as well. And that's where a good relationship with a dental provider, getting a good recommendation and knowing all the options is important.
Can you speak to painless anesthesia options and if bone grafts ever come into play?
Okay, so painless anesthesia and whether or not bone grafts come into play. So painless anesthesia has a lot to do with the skill of your dentist. There are a lot of things that can be done to make dental injections, which is usually what people get afraid of or get scared of, make them tolerable. We do a lot of things here at Integrity Dental to make that initial dental injection, the important anesthesia, more tolerable. The first thing that we usually do is put gel on the gums so that when the needle goes in, you feel a lot less of it. We also have found that pressure sensors override a lot of the pain sensors. So when I do an injection, my patients will notice that I rub and massage the area as I give the injection to provide some form of distraction. I often also have one of my assistants tap on a shoulder to help distract and keep a patient's mind off of it. Anything you can do to keep your mind off of what's going on is helpful, whether it's music or we offer videos or Netflix or something like that. So watching and having something to listen to while that's going on is also valuable. You can do some things ahead of time, like nitrous oxide or laughing gas, or even Valium, which is a prescription, but those things are things that help deal with the nervousness and make it a little more tolerable, a little less nervous to have the injection. It doesn't really take away from the pain of the injection. We also warm our anesthetic up. The anesthetic that goes in, if it goes in at body temperature, is less noticeable than if you give an injection that is cold and that's been sitting at room temperature. The body notices that more as well. And so there's also places to inject that are less painful than others. And that comes down to the skill of your dentist, how many injections they've given, whether or not they really value giving painless injections. You know, I've had the benefit of learning from a lot of older dentists that have been around for a long time that have given me a lot of tips and tricks to just make that a little bit less painful, less of a big deal for patients when we actually do the anesthesia.
And bone grafts.
Oh, bone grafts. Bone grafts would be necessary in a couple of different situations. If you're taking a tooth out, it's always great to keep more bone. Bone is priceless in your mouth. Whether you are keeping teeth around or if you're going back in with an implant, the more bone you have, or even if you're doing dentures down the road, if you have more bone, that's more for a denture to hold on to, and more stable. A more stable denture stays better, and you have less sore spots come up because of a stable denture. So yeah, putting a bone graft in when a tooth is taken out is always a good idea. There's expense that goes into it, but I think that's a great thing to do. And a lot of times what we'll do for patients when we take a tooth out is not only bone graft, is you can put an implant in at the same time you take a tooth out, sometimes, as long as the patient still has enough healthy bone in the area. And that's less invasive. It means down the road we don't have to numb you again and go back in and put the implant in after the tooth has come out. If you can do it all in one appointment, and less bleeding and less invasiveness, that's great.
Why might I need an emergency root canal?
Why would a patient need an emergency root canal? Well, if you're in pain, a lot of times what happens is that the tooth becomes infected. That's often why we do an emergency root canal. Or the tooth dies, okay? The root, the internal portion of the root, the pulp, the nerve starts to die, which is also very, very painful. A root canal is, to put it simply, a filling on the inside of your tooth, where we go in and we take out that either infected or necrotic dying nerve, and taking that out will immediately usually provide some form of relief. It may not be 100% of pain relief, but it usually helps quite a bit. So an emergency root canal is doing a root canal when a patient is already in pain on a tooth. Now, sometimes that can be challenging to get a patient numb. If your tooth is already hot when we're doing a root canal, it is a little bit more difficult to get you numb. It might require a little bit more anesthesia to get you numb. But that again is where a skillful dentist, skillful doctor comes into play. A good one will know what to do and can usually get a tooth numb prior to going in and doing that. But a lot of times you'll hear the horror stories of a patient having a root canal when they're not completely numb. And that's excruciating. It's very painful in that sort of situation. So having a good relationship built ahead of time with a doctor, as opposed to going into an emergency dentist, is that much more important in those situations, I think.
Do you offer same-day care?
Do we offer same-day care? Meaning the patient comes in pain and wants to have care or treatment administered that same day. The answer to that is often. We can't guarantee that. If our schedule is so busy because of lots of emergencies, a lot of times we may not have time to do the treatment that same day, but that is my goal. I'll tell you that my personal goal, and I can also speak for Dr. Comerci, in that if a patient is in pain, getting that patient out of pain, getting treatment administered is our top priority. And we will look for any way to move schedules around, work through lunch, come in on off hours, perhaps if the patient needs it, to get that work done once we know the extent of the emergency and what all needs to happen.
Can I schedule late hour appointments?
Can I schedule late hour appointments for emergencies? The answer to that is yes, but that's purely at the doctor's discretion or the doctor's ability. We are here to serve our community. I am here to serve the Pueblo community in what I provide as a dentist, and it gives me a lot of satisfaction and a lot of joy to be able to help people that are in pain. That's the reason I got into dentistry. So I try to find room in my schedule to allow me to treat patients that are in a lot of pain and treat them very quickly. But I also have a life, I have a family, and I have other responsibilities, and there are times where I might not be able to do it that same day. But we are very good at getting a patient treatment, especially if they are in pretty serious need or some form of pain relief, very quickly. Within a day or two, we're usually very good at that. I would be very surprised if a patient has to wait more than 3 days, and usually we're trying to get that done same day if a patient comes in and they're in pain.
Can I be seen on weekends?
Can you be seen on weekends here at Integrity Dental? The answer to that right now, unfortunately, is no. We do not have the staffing to be able to see patients on the weekend. That's a goal, though. I would say we would love to be able to help patients that can't get in here on regular, normal business hours. to be able to see them and deal with their dental pain, dental needs in outside of the normal work hours during our week. Well, I hope this information has been helpful for you. We love to treat emergencies. I would say that may actually be my favorite procedures, to help people that really, really value that care, and the ability to help people get out of pain is a wonderful skill. I think it makes me feel needed, and to be able to provide that for the Pueblo community is awesome. I value that a lot, and we have built a lot of our practice around that. I would say that we're pretty good at it as well. We take a lot of extra steps to make sure you are comfortable and get you out of pain very quickly. And we have a lot of technology that helps us do that in ways that a lot of offices also cannot help with. So we would love to be able to help you in your dental emergency. You can get a hold of us outside of normal business hours. Again, that is solely at our availability, but we have an after-hours emergency number that you can reach by calling in. It's on our answering service, which will connect you to one of the doctors that's on call, and we'll get you called back as soon as we can. Now, sometimes we may be out of cell phone service, may not be able to get you called back right away, have other commitments, but we sure try to, especially for established patients. So I'd encourage you to be an established patient. We make that a priority. And then a lot of times we'll even, if we have time, help patients that are not currently patients get some form of pain relief, even if it's outside of normal business hours. If you would like us to help you with that, please call us at Integrity Dental, 719-545-2468, and we'll do our best to help you in any way we can.